Regaining full knee extension range of motion is the single most important thing to achieve as early as possible after ACL surgery. Yet most people go months or even years without ever truly getting it back. And here's the problem. The majority of my online clients come to me after they've already been through traditional physical therapy. They're frustrated, they're stuck, they're dealing with pain, stiffness, weakness, and a knee that just doesn't feel right. And when I assess them, I almost always find the same thing. They don't actually have full knee extension, even though they were told that they do. This is a massive issue in ACL rehab. There's a lot of confusion, even among physical therapists and surgeons, about what true full extension actually is. And when this gets missed, it leaks into every part of recovery. So in this video, I'm breaking down what true full knee extension really means, why it's critical for both short and long-term knee health, how to accurately assess it yourself, and the most effective exercises to restore it, whether you're fresh out of surgery or months down the line. Before we even talk about any exercises, this is the most important concept to understand. Full knee extension means symmetry with your non-surgical knee. With very few surgical exceptions, the goal after ACL surgery is 100% symmetrical extension compared to your opposite side. Yes, even if your non-surgical knee naturally hyperextends. This is where so many people get misled. I can't tell you how many clients come to me and say, my physical therapist told me I have full extension. But when we actually compare side to side, they're missing 3, 4, sometimes 5 degrees compared to their other knee. And here's the key point. Getting your knee to 0 degrees or flat is not enough if your other knee goes beyond that. Those last few degrees matter. In fact, restoring that final bit of symmetry is often the big domino that gets many of my clients unstuck after plateauing for months. Without symmetrical extension, you're missing a non-negotiable milestone in ACL recovery. And that deficit will leak into everything else that you do. Even a small loss of extension can be detrimental for active people. It will alter biomechanics and affect walking, running, jumping, and athletic movements. If you don't have symmetrical extension, your gait won't be normal. And if you can't walk normally, what do you think happens when you try to run or return to sports? You might be thinking, my extension's close. Do those last few degrees really matter? Yes, they absolutely do. Research has shown that a loss of just 5 degrees of extension leads to a persistent flex knee walking pattern, increased joint loading, patellofemoral pain or pain around the front of the kneecap, quadriceps inhibition, and long-term weakness. And without full extension, your quad simply cannot function optimally, which can set you up for chronic weakness and compensations. This isn't just about short-term recovery either. Studies have shown a higher prevalence of knee osteoarthritis in individuals when full range of motion isn't restored, and better function and quality of life in people who do regain full extension. And timing matters here. A 2015 study by Nolan colleagues showed that knee extension range of motion at 4 weeks post-op was strongly correlated with extension loss at 12 weeks, reinforcing how critical early, proper intervention is. Now, different people progress at different rates, but the message is clear. The sooner you restore full extension, the better your recovery will be. If your assessment is wrong, your rehab will be wrong. This is why I strongly recommend being assessed by a true ACL specialist. And yes, this can be done accurately online. Most of my clients were told in person that their extension was fine, but when I assessed them remotely with a proper setup, we uncover what was missed. So if you want real expert guidance to find the bottleneck in your recovery, head to the link in the description to book a free call with me. With that said, here are some tips on how you can actually assess this yourself at home. First off, this assessment needs to be done on a flat, firm surface. The floor works best. For the first view, prop your camera at knee height directly from the side. Lie back with your legs straight out, toes pointed up but relaxed. Actively press the back of your knee into the floor by squeezing your quad as best as you can. For part 2, place a firm object underneath both heels, like a foam roller, a yoga block, or a rolled up towel. Let the knees relax and sink down. Then, actively press the knees down again. Using the images, a line should be drawn from the hip to the knee to the ankle, and then compare side to side. For the front view assessment, place the camera directly in front of you, facing the bottom of your feet. Again, press the backs of your knees into the floor as best as you can. Compare heel height. This shows your degree of heel pop, and this is where symmetry, or lack of it, becomes obvious. Not all extension problems are the same. Many people feel like they're doing everything right, but still aren't improving, because they're not addressing the root cause. Extension limitations can be an active problem, a passive problem, or a combination of both. If you want a full breakdown on how to determine which one you have and exactly what to do about it, I have a dedicated knee range of motion video. I'll link it in the video card above and also in the description below. Now the part everyone wants to jump to. What exercises are best? But remember, what you need depends on whether your limitation is active, passive, or both. So if you skip to this part of the video, you're missing a major component. With that said, here are some effective ways to start working on this at home. Quad sets are a non-negotiable part of early ACL rehab. These active quad contractions not only restore extension, but they also help reactivate your quad muscle in the early stages after surgery. There are many ways to effectively dose these. 10 to 20 repetitions of 10-second holds done multiple times throughout the day can be a good place to start for many. High frequency and high repetition are important here. Heel props are another early staple. Prop your heel up on any surface, such as a towel roll, a foam roller, a coffee table, or a chair. It is important that there is nothing under your knee. Relax and let gravity do the work. Aiming for 10 to 15 minutes is tolerated. To increase the intensity of this stretch, you can add bag hangs with light weight, or you can also perform quad sets while in this position. However, this shouldn't be an aggressive stretch. Mild discomfort and tightness is generally acceptable. A few other effective exercises include assisted quad sets, resisted quad sets, banded terminal knee extensions, and reverse banded terminal knee extensions. I'll link a full step-by-step tutorials on how to exactly do these exercises in the video description below. If you're struggling to regain full knee extension, or if something just doesn't feel right with your recovery, there's a very good chance this is the missing piece. Most people don't need more exercises. They need a correct assessment, the right target, and proper programming. If you want expert eyes on your knee and a clear plan forward, you can book a free call with me using the link in the description. And if this video helped you, make sure to like, subscribe, and share it with someone who's going through this ACL recovery process, because this is one of the most overlooked yet most important parts of recovery.